Hello, my name is Muhammad Adam Shahril bin Basirun, KIB190028, first year of Biomedical Engineering. So, I have made a case study that related to a 71 years old man with unilateral transtibial amputation. So now, I will tell about the patient's condition and his background. Name given is Mansoor, who is my grandfather. He is 71 years old and was retired from being a police last 20 years. Last year, he had a diabetes record and got left transtibial amputation. And now, he is not an active person anymore and just staying at home. So now, I will explain about the prescription and for the justification. So for the device recommended, I will recommend transtibial prosthesis device. So for the type of prosthesis, I will recommend endoskeletal prosthesis. It is because it has pylon that covered in foam, which will make it lighter to provide the weight bearing. Next, it will ease for the adjustment of the alignment of the components. And lastly, it has ability to interchange components by removing the foam cover. So next, for the type of socket, I will recommend using total surface bearing socket, or we call it as TSB. It is because it has good pressure distribution to the entire surface of the residual limb, and also it will provide better balance. Next, it is more comfortable to use it, and it will give better suspension, also increase proprioception, and this means that it will help for the patient's movement. Next, for the type of socket interface, I will recommend using soft liner. Since my grandfather had diabetes record, so he had thin and sensitive skin, so soft liner is very suitable for him. It will ease because it is protective socket interface and will provide soft condition. Besides, it will also aid for the blood circulation by providing a pumping action, and also provide intermittent pressure over bony prominence. Next, for the type of suspension, I will recommend using atmosphere pressure suspension, or more specifically elastomeric Nestle. Since my grandfather is an old person, it's very easy to use it. So the reason is because it's very simple and effective, and also helps minimize socket twisting compared to alternatives. Next, it is also a good auxiliary suspension and doesn't create possible constriction. And lastly, it will prevent air infiltration into the prosthesis by serving as a gasket. Next, for the type of pilot, I will recommend using alloys metal, or more specifically titanium or magnesium. It is because it will give more strength than steel. So it shows the alloys metal is very durable and it lighter in weight. So it will reduce the burden for the patients to carry out the prosthetic leg. And next, it will be able to bear more weight and it will provide good corrosion resistance. So it can use in a long time period and high resistance to chemical degradation. So for the type of prosthetic foot, I will recommend using single axis foot. It is because it is suited to low to medium activity levels. So it's very suitable for my grandfather because he is not an active person anymore. Next, it will increase stability and comfort on non-level surface. Next, it is quite waterproof, so it's not easily to damage by water damage. And lastly, it's reasonably durable. So this is my design proposed for the transtibial prosthesis. So that's all from me. Thank you for listening.